I'm here with Lorraine Burch, the Executive Director of Our Health Centre in Chester, Nova Scotia, who is also the Chair of the Nova Scotian Association of Community Health Centres. How are you today?
I'm good. How are you?
I'm wonderful. Very excited to speak with you. As I was saying before we started, a fellow East Coaster always makes me happy. I wanted to start by asking specifically about Our Health Centre, the client base that you serve, and some of the needs that they have at the Our Health Centre.
Okay, so I'm pleased to be able to tell you about our health center. We call it OHC for short. So it was a community project over about a 10-year span to raise the funds and to identify the gaps and do needs assessment with various groups within the community. So we are about 45 minutes from Halifax, so rural, and on the beautiful south shore of Nova Scotia. And finally, the funds were raised and the center opened in 2016. So we service the municipality of Chester, which is about a catchment area of about 10,500 that swells in the summer months with off-season residents. And it's just not limited to our municipality because we don't like discriminate against people from outside our municipality with either our primary care clinic or with our walk-in clinic or any of the other services. People are welcome here from any sort of part of the province that they wish to travel from. Yeah, sure. I'd just like to talk about why community health centers are the perfect model. So
Yes.
it is because they are a collaborative approach to healthcare. So all the team works as an interdisciplinary unit, and community health centers focus on actions to address the social determinants of health. So in our case, in Nova Scotia, we're looking at things like housing and homelessness, food insecurity, access to wellness programs, access to primary health care in all forms, including that provided by nurse practitioners who right now are not funded federally to access the public health system. So that is a big issue. If nurse practitioners could be funded through the public health system, it would make a huge difference to access to primary care. So that is a big issue with us. We also see that the community health center model is a hub and addresses the whole person, sort of that wraparound care. So the more people who are invested in the health of an individual, including the individual themselves, the better the health outcomes will be.
Um, Given the fact that you've said that you speak to and deal with people outside of that specific catchment area, what is the current situation in Nova Scotia in terms of access to community health centers, and why do you think Nova Scotia needs more community health centers?
Well, I think those of us involved with community health centers see it as the perfect model of care for people. And in Nova Scotia right now, we have 6 community health centers. They're spread out from one end of the province to the other and a few sort of in the middle. One large one that's based in Halifax that is actually celebrating 50 years. So that's quite a milestone for them.
Yes.
We do have a few others that are struggling to get started, and one in particular in Pictou County is really working hard. They're advancing their program along. So there's lots more communities that could benefit from community health centers because they provide the best model of care. We've just had a change in government, and that government, the new government incoming, has made healthcare their main platform. So that gives us great hope that perhaps they'll start to look at core funding provincially for community health centers, but absolutely federally as well, because without that, we aren't able to advance all the wellness programs that we want to do.
Of course.